Hello, I'm Danielle Conley, and welcome to Wealth Think Tank Television with your host, Dr. Ralph Steele, providing the best financial literacy, investment, and generational wealth for your children, yourself, your family, and your business.
Welcome to Wealth Think Tank Television. I'm your host, Dr. Ralph Steele, and we are live today, folks. We have a great, dynamic, wonderful show today. We have two of the most greatest Americans that you ever could meet in your life. We have Dr. Ray Lewis here, and we have Mr. Terry Moore. I wanted to call him Doctor too, but he threw some greatness at me. But you know what? We just got two great people here today. The folks, our topic today is metabolic insulin therapy for treating metabolic syndrome. And so I'm telling you, when you hear this story, you're going to be amazed. You're going to be thanked. You're going to be blessed. So today, I don't want to hold a lot of time talking about nothing else. I just want to get straight to the point. Dr. Lewis, welcome to the show. Mr. Moore, welcome to the show. And a metabolic insulin therapy, Dr. Ray, tell us what that is. Now, but before we do that, folks, you got to know something. Dr. Lewis is an Army veteran, like I'm a Navy veteran. And he went through some of the most difficult things that I did to throw you out in the middle of nowhere and you survive it. This is a great guy. You know what I mean? I don't know how I survived it, but I came back alive. Right. But anyway, Dr. Lewis, tell us about metabolic insulin therapy and dealing with metabolic syndrome.
Right.
Is it on the cutting edge? But tell us about that.
Well, we'll start by trying to define metabolic syndrome.
Define it.
Metabolic syndrome is a syndrome of high cholesterol, ineffective insulin and blood sugar metabolism, vascular disease, and hypertension.
Wow.
Yeah, those are all wrapped into this metabolic syndrome, and really one of the things that we look at in trying to determine if you have metabolic syndrome is your waist weight, is your circumference around your middle is one of the indicators, along with the hypertension, of course. But the bottom line to the treatment is that most people that the metabolic syndrome ends in what we call diabetes.
Diabetes.
And and a lot of people like to look at diabetes as being glucose problem.
Right.
And
it's more to it than that, though, isn't it?
Oh, absolutely, it's more to it than that.
So you just educated me. I mean, I'm a doctor, but not a medical doctor. I just have a PhD. But you just educated me. There's a lot of variables to the metabolic syndrome.
Absolutely. And the one that we chose to try to treat and correct is the insulin metabolism.
Yes.
As you may know, we say that people with diabetes have an insulin problem.
Right, that's right.
And it really is not it really is an insulin problem, but it's not a sugar problem, as we like to say.
Wow.
The insulin is not being effectively delivered to the liver.
Wow.
And the liver has, as you may have heard in your travels, in your life, is that the liver is the biggest organ in the body.
Right.
And it's that large for a reason. It metabolizes all of the glucose, all of the energy sources that we utilize daily and by the minute. And so that's why I'm so excited about this insulin infusion therapy. It's been out there for a while. It's been out there for a while. I think I first became acquainted with it back in 2004, 2005. There were articles on it. But
and shall I say the New England Journal of Medicine or other areas?
Yeah, in other areas, I think the New England Journal of Medicine may have had an article or two. I don't know how you can not. Matter of fact, the fact of the matter is, I did a geriatric fellowship at the medical school back from 1998 to 2000. And in that geriatric fellowship, the academic focus was on dementia.
Right.
And Alzheimer's.
Right.
And so what we were going to utilize in our study was inhaled insulin.
Wow.
You know, and that was a little bit odd for me. It was new to me because I was unaware of the fact that insulin could be used to improve memory and Alzheimer's disease.
Wow.
And so now, here we are, come forward 22 years.
Yeah.
A lot of the literature is calling Alzheimer's diabetes type 3.
Wow.
And so
that's some deep stuff there.
Yeah.
You know, and when I sit here and listen to you explain it, you know what I mean, because I'm a God-fearing man. Without I make no apologies for my faith, my belief. And so for me, I say to God be the glory and the healing power of people who need this type of, or who are receiving this type of treatment.
Right.
Because I believe God heals in different ways.
He does. And a lot of it is naturally.
Say that again.
A lot of it is naturally.
You see that, folks? The Dr. Lewis, now I'm not a medical doctor. That's my disclaimer, so you won't have to sue me. But but I hear you very clear. A lot of it is naturally.
It's naturally.
Wow.
Yeah, and that's what I was starting to kind of try to shed a little light on about the Alzheimer's and the insulin therapy.
Wow.
We had started to do inhaled insulin as a prevention of Alzheimer's and cognitive loss.
Wow.
About a third of the way through our study, Big Pharma came in, and that's when they were doing the Menda and Aricept trying to get it to market. So Big Pharma came in and said, okay, y'all put this aside, and we'll pay you to do this study.
Right.
And so consequently, there haven't been many studies done on the insulin infusion therapy and its impact on cognitive function and really the total body function. Now, we know that if you use this type of therapy, the insulin perfusion therapy, then you're going to decrease the need of dialysis. The kidney function, of course, is one of the things indicated in diabetes. Peripheral vascular disease, neurological disease with amputations of limbs, and all of those things can be 80 to 90% prevented with this type of therapy.
That is phenomenal, Dr. Lewis. That's phenomenal. And for me, as a layperson, when it comes to the medical science, that's healing power. See, for me, if you talk about, you know, I was saying, grandmama said an ounce prevention is worth gold.
Right.
To me, that's natural spiritual healing power in the form of medication and treatment.
Right.
Helping people to live what I would call, deem to be a quality of life.
Absolutely, quality of life. That was, matter of fact, that was one of the things that keep pushing me to try and make sure that this procedure and this therapy is successful and made public to the American public. I'm a geriatrician, as I stated before, and it is absolutely heartbreaking to me right now because there are so many patients on dialysis, just lost all their kidney function. So it's not a passive procedure. Dialysis is a very hard procedure to have to do 3 days a week, 4 hours a day.
Wow.
And so they, fundamentally and essentially take the blood out of your body, try to clean it up and put it back in your body.
Wow.
So it's so heartbreaking because I feel like 90% of that is preventable. We can do that with this infusion insulin therapy, which takes, initially it may take a couple of treatments a week.
Sure.
And we're talking maybe 3 hours, but as your body becomes more naturally attuned to insulin,
Right.
then the hormones that are in the liver and the other metabolic pathways will normalize, and so you end up reducing the amount of treatments and the number of treatments that you have to have with this therapy to once a week, maybe once every 2 weeks.
But now let me ask you, so, but a person who's getting the treatment, though, cannot be on already taking dialysis, though, right?
That is an area that we have not dove into, and I, really like to see us get into that. But most of the people that are on dialysis are under the nephrologists,
right,
the kidney specialists that own the dialysis clinics. And so, in my opinion, I don't feel like they really want to participate.
I'm with you on that.
Yeah, they don't really want to participate in studies that would reduce their need.
Yeah. See, in law, because I work in the law area, to me that's called a double contract. Mm-hmm. Contract for you and a contract for me, but I get both, really, both contracts.
Right.
You get me, Theory?
Yes, I do.
Yeah.
It's a double contract there.
Yeah.
Now, tell me this here. What kind of studies have you seen or maybe been a part of, if you have, of the metabolic treatment for this metabolic syndrome in the last 10 years?
We have had very few studies, I'll say again, in the last 10 years. We've had a lot of anecdotal observations and treatments. We have a lot of studies that are ongoing, but the bottom line is that none of the patients that have engaged in infusion therapy have progressed to end-stage renal disease, to loss of vision,
Sure,
the loss of limb, the loss of neuropathy. And so that in itself says a lot about the therapy if there's no progression of the disease.
That's true, because in any situation in life, results speak for themselves, doesn't it?
Correct.
The results, if people can even study or no study, longitudinal study, or as you say, anecdotal type, they are still the results.
Correct.
Speak for himself.
Correct.
You ain't got to worry about the rest, do you?
Right. Correct.
Perhaps, though, and this kind of partly where I come in, because I'm really amazed at this, the treatment and everything.
Sure.
And so what I'm going to do is do everything I can do, so you already have an advocate for the treatment. That's why this show will be aired on KAZQ Television 32, not one time, but I'll probably do it more than one time, probably do it 4 times, right, in order so it can reach people. And then I have some other things what I'm going to do, Terry, Doctor, where I can do some, if you will, streaming and social media. I have that capability as well, because this is for me.
Right.
You know what I mean? This is phenomenal.
Right.
You know what I mean?
Yeah. And we're fairly anticipating. We have the teams in place to document the maintenance of systems. We have neurologists,
sure,
that are that are testing nerve function. They're testing nerve function, wow, going into the studies, and they will be doing repetitive assessments every 6 months and every year. And those are the cardiac studies also. And so in the renal function studies, we are documenting baseline for these studies, but most of these studies now, and these studies are going to take time. And
that's true because, that's true because I know, I mean, I've been in studies myself, not medical, but others, and I know a real study is at minimum 10 years. Yeah. You know, longitudinal study. So I do know that. Yeah. And so you're talking about 10, 20, for that matter, even 30 years.
Correct. And to the pharmaceutical industry, not that I'm being negative with the way they conduct their studies, but most of the pharmaceutical agents, they have their studies designed for 6 weeks, 3 months, you know, changes in those time frames, which, you know, fit their product, which their product. There are no really, the long-term studies or the long-term observations, you never really hear about them. Right. Because over time, they really don't make that a lot of difference. Right. The difference that they make is going to be at the beginning of the study, when they are initiated, and they will do for 6 weeks, 8 weeks. But to receive any real benefit from treatment, I feel like it has to be a lifelong study. And lifelong benefits.
And I understand that because it reminds me, my grandmama had a lot of sayings. She's, how long does it take to write a check? I don't mean that literally, but in other words, if you're going to do a study, it has to be, like I said, longitudinal, but it has to be extensive.
Right, yeah. It does, sure.
Yeah, it can't be overnight, essentially, with a figure of speech, but it cannot be overnight.
Sure.
You know what I mean? 6 weeks is an overnight study.
It is.
You know what I mean? Essentially.
Well, that's what the FDA requires for most products that go to market right now. You can get them out there with, you know, minimum 6, 8 week studies. 12-week studies are that's the standard for them in terms of pharmaceuticals. And so I'm not very impressed with that. And you can get some short-term benefits, you know, but long-term, most of the agents are going to have a negative impact on the rest of the systems. Right. You know, they test one system at a time. This product and this therapy test the whole array of metabolic functions in your body. Wow. You know, and so that's why it's taken us so long to get the studies.
So you're talking about a comprehensive study.
Comprehensive study.
Not just a, you know what I mean?
Yeah, not just overnight, not just short-term study. You know, I have a lot of patients. I think the most heartbreaking thing is the fact that I do the dialysis patients, and I take care of dialysis patients. But these patients are on dialysis for 6, 7, 10 years. Yeah. And that is horrid.
That's a long time.
Well, it's not a very good way to have to live. It really is not. You have to go there, like I said, and stay on the dialysis machine 3 times a week for 3-4 hours a day. This therapy will remove all of that, you know, and it will put you in a situation to where you go and get the treatment for 3 hours 1 time a week. Wow. Maybe 1 time a month as your body improves, because it mimics your natural insulin production from the body. And that's the beauty of this. You know, these are specialized pumps that mimic the pressure in your blood vessels and the pressures in your veins, and it excretes the insulin in a normal rhythm that would induce the liver, that huge organ we're talking about that produces all of these enzymes and do all of these things that we still don't understand. Yeah. But it induces it into a normal function and a normal rhythm. And so that's the benefit that you're going to get, and that's long-term benefit. Wow. Yes. Wow. Man, that's amazing. We'll shift a little bit, folks. You're listening to KAZQ Television 32 on Wealth Think Tank Television. I'm your host, Dr. Steele.
folks, television audience, we have today Dr. Ray Lewis and we have Mr. Terry Moore here. And I'm going to go a little bit, we'll fluctuate back. Mr. Moore, welcome to the show here.
Thank you, Doctor.
And you involved in the metabolic treatment of insulin therapy. So tell us a little bit about your experience with this.
I was diagnosed about 35 years ago as adult onset diabetic, and I had to go straight to insulin. I wasn't fortunate enough to get to take the pills or so forth, and I had really no hope of anything other than insulin. And me being, I didn't realize that I was being a guinea pig in this therapy, but I've been doing this about 12 years. And the reason that I sought it out was that I had basically lost vision through diabetic retinopathy and all that, and had unbelievable pain from neuropathy in my legs.
Wow.
And I was into stage 4 kidney failure.
Wow.
And so as I sought this out, I came to Fort Worth and began 12 years ago this therapy. And within 6 weeks from basically being blind in my right eye, I went to 20/25 within 6 weeks. Now I wish.
Wait a minute. I didn't hear what you said. Are you now? Let me look at you. Television. I got to look at Mr. Moore. I had to not to interrupt him, but what he just said, I had to stop. Your eyes were near blind, and now your eyes are, as a result of this treatment, your eyes are.
Actually, I was getting shots in my eye 3 times a year.
Wow.
And all that. And my right eye was showing real damage. And the reason I really noticed it, I went to the DPS to get my driver's license. And they switched it over to my left eye, and I read the chart perfectly. They switched it to the right, and I kept asking them, are you going to switch it over? And all that. And they said, Mr. Moore, you can't see that? I said, see what? And so I'd gone back to the retina center again and had to get permission to get my driver's license because I was basically declared blind in my right eye.
Wow.
And so, but there's a lot of blood leakage, as Doc knows, with your vessels that you get leaked. You can have the surgery, which is not a fun surgery to begin with, and all that. But people out there that are suffering with diabetes that have neuropathy, let me tell you something. That's the greatest invention as far as I'm concerned, because I have no neuropathy in my legs. It took about 9 months of treatment. Some get it sooner and all that. I have not had any neuropathy in 11 years now.
Wow.
And all that. And that is I thank God every day for that.
Now, let me ask you a question. I don't mean to be mean, because I'm not a mean person. So you're telling me, Terry, nobody paid you to do this commercial today?
Was I supposed to get paid? No, sir. No.
Nobody paid you to say that even though you have neuropathy, that you still have it, but you really not confessing that you still have it?
I have 0 neuropathy in my legs now. I sleep at night. I don't come flying out of bed with lightning bolts in my leg. But I really want to get back to what Doc was saying about the dialysis.
Right.
I was telling Doc before everybody got here that I just got back my reports, my blood work.
Sure.
My kidneys are the same today as they were 12 years ago. I have the reports that are in the offices, because they kind of follow me there at the office with my blood work.
Your records.
My records and all that to show that my kidneys are the same as they were 12 years ago, and I was headed for dialysis.
Wow.
I'm the happiest man in the world.
So you basically what you're telling me and the television audience and all of the scientists and other medical doctors out here, that you've seen a thorough, sufficient, factual analysis of your medical record to be very on point your kidneys situation.
It's wonderful. There's no thought. If you have friends that have ever been in dialysis or know anything about it, it's not only the 4-hour treatment 3 days a week, you're useless that day.
Sure.
I mean, you're totally drained, and you have nothing, no hope. When you take a person's hope, as we all know, being godly men,
that's right.
Hope is a wonderful thing.
It really is that.
It changes your stress level. It changes your outlook on life and all that. It makes you a better emotional person.
Right.
Of knowing that somebody is there to help you. I've made wonderful friends in my relationship with advanced therapy.
Right.
You get to know each other. You get to communicate. You get to talk to people about their diet, talk to people about their families. It's not you're in a room all by yourself locked in. You're in a room of people that you get to know that have the struggles you have and you've had in the past. And it's such an emotional thing to be helped.
That's almost like, Terry, not to interrupt you, but that's almost like community treatment.
Yes.
That's almost like having really almost like a family that you never had. That's you're in that together, and there's a clear understanding of everybody's situation. But you all are, here's how I look at it, what you're saying, that you all are healing together.
It's so much more than that, because you can come in and see people really change. I've seen people come in that were fixed to lose their foot or a toe. And I've watched those people treated with the therapy, and their actual feet heal where they were never able to heal. And that's something you get to smile about.
Exactly.
Instead of saying somebody going to go into amputation or whatever, and you see people coming in a wheelchair from neuropathy.
Right.
And 6 months or 9 months later, they're walking in a cane.
Wow.
And then 6 months after that, they're walking in as a normal person. And I've seen this with my own eyes. There's witnesses and testimony of that. So the good things about that they're still studying about the therapy is that there's more and more things they're learning about it that give me hope, because I do have Alzheimer's in my family.
Right.
And so I get to be part of that study, which I'm glad to be a part of that. That's why I come so regular. Is number one, I've been a diabetic 35 years. I feel like it's going to take another 35 if God keeps me here to recover from all the damage that diabetes covered early on in my before I was treated. My eyes are just a phenomena to me and all that, because it was just such a fast breakthrough with my one eye and all that. And so that's what really encouraged me to begin with. And then the kidneys and the neuropathy came along, and believe me, when you can sleep at night, there's just no description of not getting up because you're screaming with a neuropathy in your legs.
Wow.
And it's been 11 years.
We're going to take a quick break, folks. I am amazed at the information, though, the education, the phenomenal that Dr. Lewis and Mr. Moore is talking about. You're listening to KAZQ. I'm your host, Dr. Ralph Steele. Stay tuned. We will be right back for part 2.